Good morning, guys. I'm Dr. Sokol. This is my office, and we do a lot of nuclear imaging and diagnosis of coronary artery disease and heart failure. And this is my office, and I'd like to show you around. This is a PET CT scanner, which diagnoses coronary artery disease. We have a stress lab. And here we have a SPECT camera, which is a nuclear cardiology camera. It also diagnoses coronary artery disease and viability studies to see whether or not heart muscle is in hibernation and so forth, to know whether or not we should revascularize patients or not. It'll diagnose whether or not there are blocked arteries in the heart, and it's all due to inflammation of the arteries of the heart.
Are you affiliated with a number of hospitals?
Yeah, I'm affiliated with Mount Sinai, Northwell, Mercy Hospital, South Nassau, which is a Mount Sinai derivative. And I'm also chief of cardiology at St. John's. It's a teaching facility, and associate professor of medicine there.
What is your general understanding of Amaranth Oil and its potential health benefits?
From what I've read in the clinical data and so forth, Amaranth is a polyunsaturated fat. It's a beta-carotene analog, so forth. And it's a precursor to vitamin K and vitamin E, which are antioxidants. And from certain data and clinical studies that were done, it also enhances pravastatin, which is a anti-lipid therapy, a statin medications that we give for patients that to lower LDL cholesterols and lower inflammation around the arteries, inside the arteries of the heart. And the combination of Amaranth and pravastatin have been shown to enhance and improve LDL cholesterol profiles. And I always say it's never about cholesterol floating around in the arteries. As a cardiologist, our main concern is inflammation inside those coronary arteries. That is what promotes obstruction and plaque and eventually myocardial infarction. So whatever we do here from a standpoint of medical management when it comes to coronary artery disease, we try to lower inflammation inside those arteries. So the key word here is having an antioxidant type of profile in your biology that will decrease the rate of decay, so to speak, that we all exhibit in our physicalities. So if we can have some kind of anti-inflammatory effect that can lower the oxidation of our processes, of our chemicals, of our genes in our body, then our rate of decay, our rate of our mortality will slow down, and therefore we will live longer.
In your research, has Amaranth been a proponent of reducing inflammation?
Right. So there are studies to show that Amaranth acts as a tumor necrosis factor when given in dosages to cancer cells. It will sort of mitigate the proliferation of that and enhance, certain properties to lower that. And also with respect to having antioxidant properties and improving LDL cholesterols, it appears that Amaranth may be a very potent anti-inflammatory agent. It does do no harm. It's a beta-carotene analog. It's in nature. So it does have certain properties, like stated, the way it's metabolized, that it will enhance Pravachol, which is, to me, a tremendous benefit as a cardiologist.
What mechanisms or components of Amaranth Oil contribute to its potential cardiovascular benefits?
There are no significant clinical data, but there are data to support that when used with pravastatin, LDL cholesterol is better controlled with Amaranth as an adjunct to taking pravastatin.
Could you explain how these fatty acids may impact cardiovascular health?
From a chemical standpoint, the combination of carbons and hydrogens is something very unique to every ester. And having a polyunsaturated fat, which is a derivative of beta-carotene and so forth, it has a beta-carotene analog, so to speak, has a unique property in the way it's metabolized and so forth to enhance certain properties of anti-inflammation. I think that Amaranth, as I get to use it more and as I get to study it more, I think it's something that will be more of a common use among patients, in that it does promote better cardiovascular health, promotes better overall health with respect to inflammation across the body. And I think it'll prove to be a potent antioxidant that will lower cholesterol and hopefully, mitigate the progression of atherosclerotic disease in the coronary arteries. I think that with Amaranth and alongside the other conventional medications that we use, the aspirins, the statins, the beta blockers, I think that this could be a significant adjunct into the therapies that we use as cardiologists.
Does Amaranth oil have any effect on cholesterol levels or lipid profile?
As I stated previously, yes, when used in conjunction with pravastatin, it's been shown to improve LDL cholesterols, which is the main cholesterol agent that is known to cause atherosclerotic disease. The key word here is inflammation.
How should individuals incorporate Amaranth oil into their diet to potentially benefit their cardiovascular health?
Again, there's no clinical data to support the dosaging, but there is anecdotal data among individuals who benefited from taking it in the morning and in the evening, patients with cancers, patients with joint pains and so forth, that when they took some in the morning and some in the evenings with their food as a supplement, they did report having better flexibility, mobility, less joint pain, and LDL cholesterols improving from a clinical standpoint as well.
What do you think a good dosage should be for someone who wants to use Amaranth as an ongoing basis?
Anecdotally, I think taking a little bit of a squirt of this is pure Amaranth. Just hold it under your tongue. Do one shot in the morning, one shot in the evening. Basically has no bad taste to it. And you get your dose, just like I take my vitamins every morning and take whatever supplements else that you take. It takes time for everything to work. People always expect instant gratification in whatever they do, but anything that's worthwhile takes a long time. It takes time for the liver to process and to reorganize a lot of its metabolic processes. And that kind of mechanism always requires time. And then after that time is elicited and so forth, you will see a tremendous, upscale in your overall state of health. And again, that's when I believe that your benefits will escalate tremendously.
Is there anyone that should use caution or even avoid using Amaranth oil?
I don't think there's any contraindication for Amaranth oil whatsoever. I think taking a modest dose or a minimal dose of Amaranth, like I just showed you, a little squirt under the tongue, is not going to do any damage to your body at all.
Are there any specific dosages or guidelines you would recommend for using Amaranth oil?
Yes, I think that we have now the benefit of having it in a gummy form and in a little oil dispenser. I wake up every morning and I just give myself a little dosage right under the tongue. And at night too, before going to bed. And wait 3 months and see the benefit of your flexibility, your overall state of health, your cholesterol levels, your mobility, and how it lowers the joint pain and so forth. We also have it in a gummy form. We could just take one gummy in the morning, one gummy in the evening. And I think overall, it takes a good 3 months before the benefits will be enlightened and you'll be able to notice the benefits of how you feel overall in your state of being and your health.
You've got a couple of products in your hands about people consuming Amaranth. Can you talk a little bit about that?
It's great to hear that Now we can be able to ingest amaranth as a gummy. This is pure amaranth with some collagen. Again, nothing in here can harm you or do anything bad to your bodies or have any kind of reaction to it. I think a gummy a day will help you tremendously. And here is just a pure amaranth oil that, as stated before, as I demonstrated, you could just simply squirt in under the tongue once in the morning, once in the evenings. Thank you.